Hello, everyone, and welcome. It's wonderful to see you today. My name is Tom Ross. I support RLAs, or the USAID Ethiopia Resilient Learning Activities, CLA and CKM work in Ethiopia. And it's really my pleasure to be with you here today to act as your moderator. The USAID Resilience and Learning Activity is really appreciative of your time, and we're really excited to have you with us for today's webinar on human-centered design in USAID resilience programming, focused on WASH, and how that human-centered design and WASH work together. Our learning event today will provide valuable insights and best practices for incorporating human-centered design, or HCD, into water sanitation and hygiene, or WASH, activities. And we'll have an opportunity to get your questions and provide some answers from our panelists during the course of today's one-hour webinar. RLA, who's hosting the webinar, is a USAID funding activity that supports USAID Ethiopia and its implementing partners to better understand what relief and development interventions make households, communities, and systems more resilient to the shocks and stresses that they're under. RLA provides learning, adaptation, collaboration, and knowledge management support. And it is made up of a group of organizations. The organization link is the prime on the contract, as well as Environmental Incentives, JARCO Consulting, and We Her. As I mentioned, the topic of today's webinar will be human-centered design in WASH programming. Human-centered design is a user-focused approach that places the needs and the desires of and experiences of individuals at the center of the process. So really get into what are the systems we use to try to center the user in this process. By applying this methodology to WASH, we can ensure that our interventions are effective, sustainable, and responsive to the needs of the communities that we serve. The webinar features experienced WASH practitioners from Ethiopia and around the world, so a diverse set of experiences, who will share their practical tips on implementing HCD. And you'll also, as I mentioned, have an opportunity to ask questions through the chat and get your responses from our panelists. So if we could go to our next slide. So how are we going to get there? So we'll have a welcome and overview. We'll keep it short and brief so we can get to the HCD panelists and experts. We'll then start with an overview, providing sort of broader context on human-centered design and the WASH experience and how they work together. We'll then move on to getting into the practical experiences of working in country in a large activity with HCD programming in Ethiopia. And we'll have panelists speak to the work, their work on the Preserve RIFSA activity. We'll then pull our lens back a little bit and go to another country and learn about how HCD has been used in the Fiavana project in Madagascar. And we hope to have about 10 to 15 minutes for questions and answers from you all who are attending the webinar before we quickly close at the end of the hour. But before we get into our first presentation, we have some basic ground rules. So, excuse me, go to the next slide. So I wanted to introduce our speakers first before I get to the ground rules. I've already introduced myself. I'd also like to introduce Jess MacArthur. She is Research and Learning Advisor for PRO-WASH and SCALE, and she'll be speaking to that broader framing of HCD and WASH. We also have Martha Gabeyehu, who is WASH Director at IDE Ethiopia, as well as Rebecca Merrifield, who's Senior Designer at IDE Ethiopia, to speak to IDE's work under the Preserve activity. And finally, we have Tina Tenda Muvuti, who's a Technical Advisor for WASH for ADRA International. He'll be speaking to the Fiavana project in Madagascar. Great. So to circle back to those sort of the mechanics, the ground rules, we'll have about 1 hour for the 3 presentations that will last about 10 to 12 minutes each. This will leave us about 10 to 15 minutes for questions and answers before we have a quick closing. During the presentation, we'd really like to encourage you to be able to ask questions and engage. So we encourage you to use the chat function for that, for asking questions and making comments. We'll be tracking the chat and capturing questions that you put in there and bringing them forward to our panelists during the question and answer session. If you have a question that's for a specific presenter or panelist, please put their name in your question and we'll get that directed to them. The final note on the chat is that we'll also be dropping in some links and information about the resources and websites of our panelists and presenters, so you can dig a little bit deeper into their experience. Great, let's move to the next slide. So with that, I'd like to get into our first presentation. So I'm pleased to hand it over to Jess MacArthur from PRO-WASH, and Jess will provide a high-level framing and overview of HCD and how it has moved into the WASH sector. So over to you, Jess.
Thanks so much, Tom. I hope you can hear me. My name is Jess MacArthur, and as Tom mentioned, I am the Research and Learning Advisor with PRO-WASH and Scale. I'm calling in today from Zurich, where I'm actually joining another conference. We're looking this week at humanitarian contexts and how we can use things like human-centered design to support WASH in humanitarian contexts as well. Next slide. So let's start with the basics. What is human-centered design? Many of you have probably heard or maybe are familiar with human-centered design, but at its core, it's this innovative problem-solving methodology. We can call it many, many different things, but essentially it's a way of solving problems to identify contextual solutions. These solutions might be products, they might be strategies, and they might even be messaging. So we've got a picture here of a big boulder in front of the path, and this is a great example of what HCD can be used for. It's helping us to figure out either how to go around, go under, go over, or go sideways. How do we get over this boulder and move forward on our journeys together as development practitioners? Next slide. Well, what about HCD in WASH? So it's been used for about 20 years to help unstick difficult WASH challenges in the design of business models. It's also been used to look at messaging strategies, and as we're probably most familiar with, WASH products. But when we think about how HCD has been used in WASH, there are some really great examples of WASH products and services being designed using human-centered design principles that go back 50, 60, 70 years. So the idea is, how do you bring people, the end users, those people that are actually going to be using those products or hearing those messages, into the design of the solutions? So we often I talk about garage inventors. Maybe you've heard of this idea of an inventor making something in a garage, and then how does that actually work in the real world? And so this is helping to bring the solutions, in the design of the solutions, into the real world so that they're not disconnected. Next slide. So we can talk about different ways of understanding HCD, but I like to talk about it as the kind of values that are underpin HCD. And HCD, human-centered design, it requires a different set of skills than traditional WASH programming. So normally we look for engineers, we might look for public health professionals, we might look for sociologists, but really with HCD, we're looking for people that are empathetic, that are participatory, that are creative, and that are iterative. And some of the best HCD practitioners that I've worked with in WASH actually don't have a background in WASH because they come at these challenges with unique and different viewpoints. One of my best collaborative partners was someone who worked as an administrative assistant in our Bangladesh office, because she was super creative, very innovative, and an incredible ability to speak with people and understand their challenges. And so we don't necessarily need the same types of skills. And that's why maybe it's a little bit difficult for WASH people to break out of the bubble of being engineers or being public health professionals to step into this world of creativity. Next slide. So when we think about HCD, again, there's no one way to do HCD. People have been doing HCD for a long time. And so I'm not going to try to put a label or a definition on it. But when we think about the process, that process is often similar. Now, you'll see me presenting it here quite linearly. Later in the presentation or today, you're going to see a different version of this diagram. But essentially, it is a process that moves people through trying to understand challenges, trying to create ideas to solve those challenges, and then moving those solutions to scale. And we, in this particular diagram, label those as discover, create, and deliver, or here, create, and deliver. And these resources and tools that I'm sharing with you are actually from the HCD for WASH website. So all of this stuff is available online. When we think about the discover phase, this is this phase of exploring challenges with people. By that, we often mean clarifying our objectives. What are we actually trying to do when we get in the room to design a solution? Trying to figure out what we already know. What things do we already know about the particular problem? And then going to work with communities and stakeholders to uncover new information. You might know this phase as formative research, but again, I encourage you to think about this more expansively and thinking not only about helping us to uncover new information, but to frame the problem in the lens of community members. So for example, working in Bangladesh, going into communities, we need to solve the problem with arsenic. You know what? No one actually thought arsenic was a problem in the communities we were working in. They thought iron was the problem. So helping to think about things in new ways helps us to frame the problem in people's actual words, which helps us to create solutions that fit their needs better, while also solving challenges like arsenic. So then we move into this create phase where we're designing or identifying our design criteria. We're prioritizing early ideas and prototyping them. So getting them actually into some kind of physical thing that we can try or we can test. And then we move into the deliver phase. This is the phase that everyone gets stuck in. And this is the phase where we pilot those ideas. We continue to iterate and refine them, and then we let go of them. We send them out into the real world and let other stakeholders, other actors, whether they be government or the private sector, media, whoever it might be, take over those solutions and grow them. And that's what makes HCD for the development space, specifically in WASH, different than the HCD that organizations like Apple or IKEA use. Again, they're using similar principles, but for them, they're able to own those solutions and take them forward. For us as development practitioners, often we have to hand those solutions off. And this is where we often get stuck in the WASH sector. Next slide. So I want to give you a few inspiring examples. I will say that these are inspiring, hopefully from things you might learn, but also ways that things haven't worked so well. So how have we used HCD in WASH? There's a lot of examples here from IDE and PRO-WASH and Scale, and that's because we collaboratively created the HCD for WASH website, which is this massive database of tools. But there are many, many other examples, and we'll hear a few more today. So one example is helping to identify a suite of appropriate household hygiene products in Ethiopia. This particular project is in the create phase. And one of the things we're doing is looking at all of the different behaviors that help with household hygiene, of which we identified 18. And now we're trying to narrow that down to a suite of products and appropriate messages to help families better conduct behaviors that are healthy for themselves and for their children. Another example from PRO-WASH and Scale is in Zimbabwe. And in this particular context, we came in thinking we need to design a new latrine. The problem is the latrine. That's the problem. If we can just figure out how to make a fancier latrine, maybe it needs to be fancy colors and there needs to be bells and whistles. Maybe it should float, make it really interesting. Then we'll solve sanitation in Zimbabwe. And when we actually talk to people, which is the whole point of HCD, we realized that the problem wasn't the product. The product's actually quite good. The toilet's a really good toilet. The problem is that no one understands the toilet, from government all the way to community members. And so again, it's what is the actual problem we're trying to solve is probably the most important part of HCD. Next slide. Few more examples here. So again, my colleagues from IDE are on the call. I was with IDE for a number of years, and so many of these are also from my work with IDE in Bangladesh and across the globe. But HCD has been used to design an affordable water filter, so taking kind of a basic filter that met the needs, the practical technical needs, but helping to make it more desirable. So again, the problem was, how do we make this product marketable, that people want to purchase and own and use? Also been used to understand how we can support gender-sensitive sanitation enterprises in Ghana. How do we get more women working in the sanitation business? Because when we get more women in, often families adopt those practices more sustainably. Another example from Bangladesh is how do we make flood-resilient sanitation? And this was another one where I had floating toilet underlined triple in my notebook, thinking, how do we design a toilet that floats? And when we got to the field, we realized the problem wasn't the floating toilet. It was that none of the installers knew how to install the existing fully functioning toilets to be flood resilient. And so again, it's not necessarily about designing products, but what is the infrastructure that fits around those products to make sure that they work well? It's also been used to design a low-cost tube well platform in Bangladesh, helping to keep water points safe. Next slide. It's been used to increase hand washing practices in Cambodia through the Kekomrum marketing campaign, which was working with grandmothers who are often working with kids. And so it was a behavior change messaging system. Another example is a women-friendly shelter, again from Bangladesh, where all the little train shelters were super tall and super skinny, and we couldn't figure out why. So we went to the community, we used human-centered design, we tried to understand what the actual problem was. And the problem is that's the shape that the tin comes in. So if it's super skinny and super tall, no one wanted to take the time to cut it. So we developed a cutting mechanism and we were able to train entrepreneurs of this is how you can cut the tin in a really clever way. You don't need any more tin than you're normally buying, but this is how you can make a low-cost shelter that's actually friendly for women. And then we've got two more examples, which I'm really looking forward to hearing from the rest of our colleagues today. So one from IDE Ethiopia and Preserve, and then also one from ADRA Madagascar, looking at sanitation strategies and hand washing. So just one quick moment to just pull all this together. You may have been doing human-centered design without even knowing it. So there's a lot of overlap with participatory methods, ethnography. There's a lot of interesting things of how it links to market-based sanitation or market-based approaches, behavioral messaging. Good approaches actually often use the exact same principles that we're speaking about. But what the difference between, I would say, HCD and these kind of participatory methods is moving from that formative research through that piloting phase and then actually getting it to deliver. And again, that's probably where most of our work fails, but it's that purpose of how do we take these ideas and hand them off to someone else so that they can do things well. Essentially, it's just good development practice. It's doing things properly, and we're putting a framework and a strategy and a way of doing it, really talking to communities, making sure that we get these solutions that actually meet needs that they describe. So it's just a way of doing good development, I think, but we use the fancy label, we use HCD, and we bring in lots of fun tools and activities and ways of doing this research, making it participatory, making it interesting, and hopefully solving some really challenging problems. So back to you, Tom. Thanks so much.
Yes, thanks so much for that excellent framing and some great examples of diverse practices and experiences around the world. So next we'll hear from Martha Gebehu and Rebecca Merrifield from IDE and Preserve Ethiopia. They'll share their experiences integrating HCD into their WASH work in Ethiopia. So I'll hand it over to Becca and Martha.
Thanks, Tom. So I'll just share briefly a little bit about how we do the HCD work here at IDE Ethiopia. So I do work as a designer, but to Jess's point, like it's really everybody, and I'll touch on that in just a second. So Evan, you can go to the next slide, or actually the one after that. Yeah, again, yeah, that's good. So we have a team of more than 10 designers working in our country offices at IDE and other locations around the world. And as designers, we aim to utilize this methodology and the principles and values that Jess has just shared in all of our work across our WASH projects as well as other projects as well. But as she said, really design work is not just done by designers. It's a collaborative work that we do hand in hand, especially with WASH practitioners, but also others. And so I work in our Ethiopia office with Martha and other WASH colleagues so that we can all adapt these kind of principles, mindsets, and practical tools that we can use across our work. It's not just to be siloed within a particular individual or sector. So you can go to the next slide. So we follow basically the same process that Jess has outlined from discovery to delivery. It really is the same. This is just a different visualization with a few more steps or stages involved, as you also mentioned, and a slightly different way of visualizing it, especially because we like to emphasize this kind of experimentation and the fact that in reality, it's really an iterative approach. It's quite messy. It's not an A to Z process. Oftentimes we're skipping back and forth as we're trying to learn. So in each of these stages, we are user focused and we engage potential users of sanitation products and services in order to understand their needs, their preferences, desires, and to design solutions together. So we also engage other experts and stakeholders. So these could be like WASH technical team members, private suppliers, government actors, community leaders, and influencers. Because we're not just designing and selling a single product, but we're trying to create an entire, to develop and capacitate a sanitation market. So this includes a lot of different actors, right? In which all of these actors are interacting, they're affecting the uptake of improved sanitation behaviors. So it's just an important thing to remember that this process is not just about, being a designer or only engaging the user. Of course, we want to be user-focused, but it involves a lot of different types of individuals and processes in order to fully understand and develop the kind of complex solutions that we might be working towards together. So with that, I'll hand it over to Martha to give us a more in-depth look at one of the projects that we are working on in Ethiopia, Preserve.
Thank you, Becca. So today I'm going to share our experience using human-centered design in one of our WASH projects called Poverty Reduced Sustainably in an Environment of Resilient and Vibrant Economy, which is Preserve. It's an integrated activity to improve the food security of vulnerable households in targeted PSNP communities in Amhara region. So ID's role in this Preserve is primarily to drive sanitation access through building market for sanitation. So we used human-centered design to deeply understand the context needed to inform the interventions that include gaining more understanding of current knowledge, attitude, practice, drivers, and also communication channels in WASH behaviors to inform interventions. So HCD added value, mostly in customer insights, both opportunity and barrier side. And also we like prototype and testing to refine our business model, also our strategy. During the delivery phase, also we capacitated actors to engage in market-based sanitation and support with the social behavior change among customers. Next slide, please. Yeah, during our research, we generated key insights from the research. One is the household would like an aspirational and affordable toilet that offers a much better value and experience than the latrine that most people know and have used in the past. When we asked about each person's ideal toilet, most people mentioned components that were durable and easy to clean. Specifically, people wanted a floor that was washable and a well with block, a roof with iron sheet, and a concrete slab. The other finding is our findings reinforce the importance of inclusive financing for sanitation solution in these waradas, while some requires financing for toilet, but others who have already land and livestock are willing to pay in cash. But they want to pay after like harvest or sales, indicating income seasonality, relevance in cash purchase. The other finding we have is people understand the importance of sanitation, especially in community health and environmental cleanliness, such as like they providing a clean area for children to play and maintaining odor-free surrounding. So our research actually revealed like three main main reason motivating customers to invest in better latrine. Such as like privacy, people don't want to be seen or feel ashamed. Safety is another issue, like people don't want to feel safe and comfortable. And also like the majority of people considering having a latrine as source of pride and dignified, which is especially for women and girls by enabling them to use facilities at any time of the day. So this is the three key motivators we found during the research. When we come to the supply chain, there is no supply chain in that particular rural area. Most people don't know where a complete toilet can be purchased. People are aware of where to buy different materials, but they don't know if or where there is a one-stop shop that sells a ready-to-be installed latrine. And with the demand creation or influencer, during the discussion with customer and stakeholder, it was like they were suggesting that influential community members and leaders, like religious leaders, can be effective by encouraging others to see the advantage of purchasing and using latrine. Next slide, please. So we prototype different products based on the knowledge we get from the discovery phase. So based on the idea generated, we prototype and testing product preference and how they would like purchase, also their willingness to pay and financing piece. We also see like the transportation and installation options for those products. We also test like message that resonates with them to develop our social behavior change communication material. So this was done through demonstration, follow-up conversation, sharing of photos, using feedback from and we collect feedback from the first round prototyping, which is a low resolution prototype. And we tested the physical prototypes to further refine products and financial model and also messaging materials. Next slide, please. We do also market segmentation. So our research find that the testing confirmed it is best to target both early adopters and early majority, because the group of early adopter is not very large. So it's worth to targeting both segments at the same time during the rollout phase. So our first target customers are like wealthy farmers who have more than 1 hectare of land and also lots of livestock, and also households who have a second income source in addition to farming. The other early adopters are model household, individual who is a model community member who have a better latrine than most in the community, and also open to new technologies. So the third are the people who have a risk taker mindset, involved in different business are the early adopters. Next slide, please. So when we come to demand creation, so ID engage individual sales agents drawn from the community as the main promoters of the latrine products. So sales agents use side seller, which we develop based on the message we tested that resonate to the customers. So to promote sanitation products door to door at the marketplace and also around health posts and Kabale location area. So they are supported by health extension workers who are a government staff at the grassroots level. Also, we use women development armies who are volunteers at the community level to support sales agents into demand creation. We also use a religious leader based on the finding we have in the discovery phase. There are role models in using sanitation product and also teaching the community after Sunday service, after Sunday church service. Next slide, please. So the supply chain, as I mentioned earlier, like we don't find supply like a well-established supply chain in rural areas. So we establish a supply chain for sanitation product and service by building individual latrine business owners to produce sanitation product at the Qabali level for ease of transportation. So, and link them with retailers who are selling plastic sanitation products, and also link with the raw material suppliers so that latrine business owners purchase the raw material from the local markets. Next slide, please. So this is our market-based sanitation business model. We build a robust market-based sanitation business model that leverage the strengths of both private and public actors to drive sanitation and uptake. So including ID trade sales agent and latrine producer who are drawn from the communities, as well as working with the government employed health extension workers. So ID promotes, as I said, a direct sales strategy, creating a network of sales agents who promote like those products door to door and at the marketplace. This sales agent received a commission from the latrine business owner, ensuring that the sustainability of the model. So we are also working with financial institutions as finances in this a key issue in market-based sanitation. So we work with unions, microfinance institutions to avail loans for both customers and business owners. So this is our overarching market-based sanitation business model. So we adapt based on the context when we enter into the new areas. Thank you very much. So over to you, Tom.
Thank you, Becca, and thank you, Martha, for sharing with us your experiences working with HCD and designing products and improvements for Ethiopian communities. Really much appreciated. And now I'm going to hand it over to Tina Tendemovuti to give us some global perspectives on the lessons from the Fiavana project in Madagascar. Tina, over to you.
Good morning, good afternoon, and maybe good evening to all of you. It's good to see some familiar names from across the WASH world. Next slide. Fiavana is a 5-year resilience food security activity funded by USAID BHA and implemented by the Adventist Development and Relief Agency, ADRA, and its partners, with FHI 360 leading our SBC activities. The program aims to achieve sustainable improvement of food and nutrition security and resilience of vulnerable populations in the 3 regions of Atsima, Atsinanana, Fatovavi, and Fitovinani. In 2021, at the beginning of this massive undertaking, 66% of households within Fiavana's target regions were found to practice open defecation, and only 3% had improved household-level sanitation facilities. In the same regions, only about 4% of households had soap and water at a hand-washing station on their premises. Though not defined as such from the get-go, the steps taken by Fiavana to deliver sanitation and hand-washing improvement can be described using the HCD framework. Next slide. So like Jess mentioned, when most people think HCD, they think products rather than strategies. The first part of my presentation has to do with HCD in strategy development. So in the chat, Desta asked how the HCD process is different from participatory community problem identification like CLTS. This part of my presentation will hopefully answer that question. So when the project started, instead of defaulting to continued sanitation promotion through community-led total sanitation, popularly known as CLTS, Fiavana co-created a sanitation promotion strategy with community members. The formative research became the hear phase, community strategy co-creation became the create phase, and a rollout of sanitation improvement interventions within communities became the deliver phase. The formative research started in October of 2021 in 9 representative communes across the 6 districts of Fiovana's working areas. This included key informant interviews, focus group discussions, and in-depth interviews with traditional leaders, champions, adults, and youth. And this helped us uncover the strong cultural attitudes towards OD. And what we found was strong resistance towards latrine adoption. In addition, some barriers were uncovered. For example, given the poor quality of the few existing latrines in the project area, several negative perceptions regarding latrines were noted. They're smelly, kids and chickens sometimes fall in, and they are destroyed each time there's a cyclone. Other barriers included lack of land or space for the ideal location of latrines, a high water table, which posed difficulty in latrine construction, but some enablers also came up. For example, not having to clean up OD areas during harvest time, and like mentioned by our colleagues from IDE, feelings of pride, particularly in the presence of visitors, that also came up. And because CLTS had been conducted before by other actors in some of the same communities that we were now targeting, the discover phase allowed us to identify shortcomings or weaknesses of a pure CLTS approach in this context and causes for resistance to traditional CLTS models that had been tried in the past. Number one, we understood the negative consequences of using incentives, like WASH actors promising to build water points to encourage ODF achievement. Number two, we learned how reliance on negative emotions like shame and disgust in the triggering process can have a negative impact. Number three, we uncovered trigger fatigue from repeated CLTS campaigns, and how the use of community sanctions or community fines known as DINA can have mixed results. We observed limited community ownership of previous CLTS campaigns and a lack of practical demonstrations. All of this helped us to put our finger on specific areas in which we needed to adapt the CLTS approach for a better chance at results. Next slide. The main objective of the next phase, the create phase, was to collaboratively identify and agree on a community-level sanitation plan and a monitoring approach of sanitation progress, rather than featuring a limited number of very challenging steps on the traditional sanitation ladder. An adapted, community-friendly sanitation tool was used to account for all possible starting points and incremental steps to reducing uncontrolled OD. Communities were allowed to adopt small, doable actions, anything that pushed the community to become ODF and reduce feces in the living environment, even if it meant restricting OD to specific areas for a time and then laying out a plan towards improved sanitation. This phase also included latrine design prototyping and design support. Next slide. The deliver phase involved identification of early adopters, model households, and model communities, as well as self-monitoring of each community's advancement on their community-adapted and adopted sanitation ladder. As of April of 2023, 126 of Fiovana's sanitation co-creation villages have been declared ODF, with a couple more expected to be declared ODF in the coming months before the project closes. And although the latrines have begun to appear in a region where sanitation progress hadn't been made in years, these initial results have looked quite different. So for example, several villages in the southeast of Madagascar tend to be clustered, and there's very little space between homes. Given the space limitation in these communities, community sanitation plans have favored the gradual construction of similarly clustered latrines around or near their settlements, or, like in the image on the left, on former OD sites near the village. As a result, latrine construction has been taken up as a community effort, and some latrines are shared. Also, resistance to invest in latrines has been observed, and a lot of the initial latrines have made use of only locally available materials, as you can see in the image on the right. As a result, by nature of these initial latrines being shared and often lacking a cleanable slab or cover, they cannot yet be categorized as basic latrines on the JMP sanitation ladder, which is an accepted indicator of the adoption of improved sanitation. Next slide. And so the project has had to strike a very difficult balance between celebrating successes that represent lower rungs of the sanitation ladder, while also urging households to make improvements over time. Community sanitation dashboards like the one on the left, which record progressive achievements towards set community sanitation goals, have been a key tool to do both, to celebrate successes, small improvements, and make it clear that it doesn't end there. Next slide. For our hand washing strategy, Fiovana adopted a Trials of Improved Practices approach, also known as TIPS, which, just like HCD, focuses on engaging the end users directly in the development and refinement of solutions. So this time we're talking products as the HCD solution. Starting in September of 2020, interviews and observations were conducted to understand local hand washing practices. Here's what we, together with Fiovana communities, found out. Number one, unavailability of soap, but the availability of known alternatives such as ash and the 2 plants that you can read in the little box. Number two, tippy-tap bottle theft and vandalism by children who saw the plastic bottles as toys. Number three, we learned that hand washing devices or tippy-taps served as visual cues for hand washing, that adopters reported feelings of cleanliness and perceived reduction in illness, and that demonstrations encouraged adoption. 83% of people that saw a tippy-tap demonstration went on to build one in their homes. So all of these findings came together to inform discussions during the create phase. We now had a collective understanding that hand washing and hand washing devices were perceived as important, but that we needed materials and tools that were accessible, wouldn't be stolen, and could be demonstrated to others and be replicable. Next slide. The create phase, again as part of our tips, involved asking families to try out new practices, including hand washing, in their daily routines and receiving feedback based on their experiences. Collaborative workshops were organized for community members to design hand washing stations. Some prototypes using locally sourced bamboo were created, and these quickly caught on. Friendly competitions were held for individuals to present the best designs that they could come up with. This fostered innovation. The involvement of youth and the promotion of hand washing in schools, we think, was key to the success of the create phase. Next slide. Continuous monitoring and support was important for adapting practices based on what works best in the local context. Also, is it practical and is it sustainable? From our tips follow-up visits, we have found high levels of sustained hand washing. During our initial tips pilot phase, a key indicator of improvement was the increase in the percentage of households with soap and water at a hand washing station on their premises, from 3% in May of 2021 to 47% in September of 2022. Last slide. But there is still a lot to learn and there's still a lot to do. So like Jess mentioned in her presentation, while HCD is really helpful to unstick issues, it's not uncommon for results to get stuck in the deliver stage. And so as we celebrate these HCD successes, these 2 cases I've presented, we still grapple with questions like, how do we maintain the momentum in sanitation and get people to invest in even better sanitation solutions? And given the large sanitation targets that programs like RIFSAs typically have, how do you scale HCD approaches to reach more adopters across larger geographic areas? And for hand washing, it's been hard enough to get one hand washing station in the home, which usually sits near the latrine. But how do we support hand washing at various junctures with a single hand washing station at the latrine? But in spite of all of these ongoing conversations, we've collected some lessons along the way. Number one, engagement of community leaders as gatekeepers and influencers is essential, and a participatory process will acknowledge their role and authority to lead and sustain change. Number two, sanitation advances in challenging contexts requires dismantling beliefs and norms through genuinely community-led, culturally appropriate, and sensitive dialogues around a sensitive topic like sanitation. And lastly, we know for sure, and we have seen that HCD can effectively break down behaviors into feasible, small, doable actions by leveraging its iterative and participatory approach. Thank you for your time.
Thanks so much for your presentation, and thanks to all 4 of our presenters for those 3 excellent presentations. It's much appreciated, and I've seen lots of comments in the chats for appreciation for the presentations, as well as really a hope that they will be shared, and which all the slides will be shared with you. Now we're going to move into our question and answer section of the webinar. I hope we can get to 3 to 4 questions during this time. We have about 10 minutes. So the first question I'm going to ask is a question to all the panelists. In all of your presentations, one of the key themes was that this is an approach and a method that focuses on reaching out and getting to the end user, getting to the people in the community, getting to those groups. So how do you make sure your human-centered design work for WASH is inclusive and really broadly gets to and gets feedback and information from that broad group of community stakeholders? So I'll open that up to the panelists. Anyone can come off of mute and give their thoughts on how do you make sure your HCD for WASH is inclusive?
I can be bold and brave. I'll give it a try, and then please others feel free to jump in. So, I mean, again, it's just like with any formative research, your inclusivity is really determined on who you invite to the table to be part of the process, both as kind of leading the process of HCD. Is it just engineers? That might be a problem. Is it just public health people? That will also be a problem. And as well as who are you speaking to? Are you just speaking to community leaders? Are you just doing KIIs, as we love to call them? Or are you really sitting down with women who are potentially marginalized? It also decides what kind of problem you're trying to solve and where those boundaries of inclusivity will be. If you're trying to solve a problem for a particular group of marginalized people, then those are the people you need to focus on. Of course, you want to talk to other people as well, but who is your focus is an important part of actually that here phase and on trying to untangle what the problem is and what is the actual scope of the issue. Yeah, any others?
I can jump in to say that, so similar to what Jess said, sometimes getting people to be involved in those conversations during the hear or discover phase is as simple as being intentional about making sure they are included in the conversations. So when you're having co-creation sessions or hearing sessions, whether you're using focus group discussions, whatever it is, how intentional are you about making sure that marginalized groups are included in the process, and that you're setting the sessions for a time when they are not otherwise occupied with other tasks like child rearing, and making sure that even the timing is inclusive in that regard. And then I'd also mention developing inclusive monitoring and evaluation strategies to make sure that we are assessing how effective all of the WASH solutions we come up are. So if you're using tips, for example, you can be intentional about making sure that the groups or the cohorts that are selected for follow-up include marginalized groups, so that as you get feedback over time, you're specifically getting disaggregated data and you're analyzing the impacts of your HCD specifically within underrepresented and marginalized groups.
Thanks, Jess. Thanks, Tino. Let's move on to our next question. This is a question, I'll start with Jess. What are some core feedback practices used to gain an understanding of the effectiveness of the design process?
Yeah, wonderful. I mean, there are many, and this is where, again, the connections to participatory and ethnographic research are strong. So any form of participatory and ethnographic research are great ways to start. So things like doing card sorting activities, doing journey mapping, doing transect walks, doing walking interviews, asking someone to try the product and give you feedback, helping, doing it yourself. Any forms of kind of participatory or ethnographic research are really useful here. Things that I love to do is I love to give people the tool or the product without instructions and come back a week later and see what happened, because that information is really helpful on how they'll use it if they don't read the instructions, because no one reads the instructions. And then we can help to design kind of nudges or strategies within the physical product if we're talking about product design, for example. That's just one kind of idea. Yeah.
Great. Thanks, Jess. Other panelists want to chime in on that question? Okay, let's move to our next question. We're going to open this again up to the broader panel. I'd love to hear from Becca and Martha from the Ethiopia context as well. This is a question from the chat that we pulled. What's a good starting point for human-centered design in emergency contexts? In that space, how can you use human-centered design in that space? So any thoughts from the panel on that question?
Well, to be honest, ID doesn't really work in emergency contexts, so I don't want to give too much, experience on that, because that's not really our area of expertise. But in terms of the principles and the values, especially that Jess presented, that's always a good place to start, and especially as you're in the here and the create stages as well, to be very sensitive to what might be the unique circumstances or potentially different situations that could be different from a normal kind of like being at your household, having certain people and resources around you, and being very thoughtful and intentional about the kinds of questions and probing that you do to ensure that you're going to be able to address those kind of unique and different needs. Because that is just a very different context in which somebody is operating and trying to access basic services, which, is very different from what there might be their normal household or family situation.
Thanks, Rebecca.
Great.
Maybe just to highlight, there's been a document that's been posted in the chat that has some really great starting places for folks who have used HCD in humanitarian context, including some WASH examples. So if you scroll up, Charlie posted it at 243. That's another good document to start off with.
Great. Thanks so much. And I think this will likely be our last question. How does human-centered design contribute to market-based sanitation? And what added value does it bring to MBS from different perspectives, such as affordability, access to cleaning sanitation, et cetera?
Yeah, let me jump in. I think for market-based sanitation, it adds a great value, especially like one is for identifying customer preference in terms of like product and service they want to buy, and also understanding like the affordability issue, willingness to pay, and also like what like key messages they are like motivated enough to invest in the sanitation products and services. So these are some of the added value for market-based sanitation approach.
Any comments from other panelists on that question about market-based sanitation?
Maybe I can just jump in again there, but some of the ways that we have also used it, oftentimes, as many of us have mentioned, we talk about the product or the service design. But so using HCD also can help us develop this kind of overarching sanitation strategy, as Martha and Tina have mentioned as well. And for example, some of the challenges that we have faced have not necessarily been with the product or even the customer demand or satisfaction, those kinds of things, but oftentimes with the supply chain. And Martha mentioned some of those issues that we have faced. And so in using human-centered design, and especially going through this iterative approach along the way, it's helped us to work very closely with those who are entrepreneurs or latrine business owners who are trying to develop a profitable business as part of NBS and providing the product to many customers. So just an example of that is, for example, we have faced many challenges with inflation and latrine business owners not being able to afford or access some of the materials that they need to in order to produce and supply latrines for customer orders. And so upon figuring that out, we tried to start coming up with additional ways that we could address that. And one way was to kind of link some of the entrepreneurs together in an association so that they could try to buy raw materials together in bulk, essentially to increase their purchasing power. And so that's just a way that, you know, there are other actors and other aspects of an entire business model that are happening beyond just the product that we're trying to get to a customer. And I think that using these practices and tools has really helped us to do that. And same thing for addressing affordability, like identifying different payment mechanisms, working with other actors such as microfinance institutions or savings groups, and figuring out what ways would be most appropriate for people to be able to, you know, like when is a good time to place an order, how can they afford it, how can they mobilize their savings or other types of finance that they might be accessing from a group or their community. And so I think it, you know, it goes beyond just this initial formative research and designing a product or multiple products through the process, but it extends to all of the actors within NBS.
Becca, thanks so much. Let me open it up to the panelists to see if there's anyone that wants to comment on any of the questions they've seen in our curated list before we bring the webinar to a close.
There's one that I was going to take because it has to do with the first case that I presented, our HCD in sanitation. And the question is, how can we innovate in latrine design and not run afoul of USAID indicators? What if the community responsive design is non-standard? And I think those are two questions. And the first thing that I was going to just mention about this is a lot of the indicators by different donors, but even the JMP indicators that a lot of these donors base their indicators on, are concerned with how effective a sanitation facility is at doing its job, right, of keeping contamination contained, which is a good thing, right? So I would say to make sure that our designs are not running afoul of those indicators, it would be a great idea to pilot the designs in controlled settings and work with communities to demonstrate that these non-design designs, which might be non-standard at the beginning, these non-standard designs are actually effective and that they meet the criteria set out in the indicators, or that they're actually doing their job. That's the first thing that I would say. And then another thing that I might have mentioned briefly in my presentation is that it might also be possible to advocate for and to add flexible indicators. So in our case, for example, we found it beneficial to advocate for custom indicators because there were certain things that were not being measured by the indicators that we had. And we felt that because we're adapting a design to make it more innovative and being context specific and all of that, we needed custom indicators to measure other achievements that we thought were important for us to record. So for example, something like recording the number of limited latrines or latrines that are not considered basic, but they're unimproved latrines. But we see that as a stepping stone, and we want to keep track of that because it says something if you don't have latrines and then you have a certain type of latrine, but it just might not have a slab. Or the percent of households, which was another indicator that we've had, without evidence of feces in the living environment, we think that that's an important indicator to have. I hope that maybe answers part of that question.
Yeah, absolutely, Tino. Thanks so much. I think that's all we have time for today. So if we can go to the next slide. I think it's, in conclusion, I think I just wanted to recap. I think, first of all, what we've heard is that HCD is not new, but it is a powerful tool to center our work on the people we're serving. And I think that's a key message, to really get to and empower the people that are using these services or products to be able to design them to fit their needs and their context. That HCD has also been successful and it's been adapted to different contexts. Today we talked about WASH, but I'm sure there's other spaces where HCD has been used successfully. And so to be creative and think about this methodology in other sectors, there's, I'm sure, a fertile discussion to be had there. And then finally, just an offer that part of this webinar's purpose is to make connections and to share the information, but also the experts that have that information. And so we do have the 4 folks that you heard from today. You know who they are, and they're wonderful peers and colleagues for you to use as a resource when you think about using HCD in your WASH or in other contexts. So if we can go to our final slide. What I'd like to say thank you. So first of all, thank you to the presenters for your time today, for your wonderful information and perspectives that you provided on HCD. I'd like to thank the RLA team for the support in making this webinar possible. I'd like to thank USAID for their support to the RLA project and across all of the projects that we talked about today, to be able to share these powerful tools and get them out there to others for their consideration. And then finally, I'd like to thank all of the participants that have been on the call. We really appreciate your time. We hope that this has introduced you to some new resources, some new faces, some new ideas that will be helpful in your work. We will be following up next week with recordings of the webinar, with the resources that we shared, as well as the answers to some of the questions maybe we didn't get to, including the slide deck. I saw multiple questions in the chat about getting the slide deck, so we will be sharing that with you. And so with that, I would like to give just a general thank you to everybody on the call, presenters, participants, USAID, everyone for their time and attention and engagement. And I will close the call. So thank you so much and enjoy the rest of your day.